Um, I'm really excited for our MC here tonight. Ray and I met actually about a year ago or so at an event that was, again, a mashup between tech and health. And he's got a phenomenal background, a really, amazing track record in a short period of time. So he's co-founder of BrightMD, a company that develops user-friendly software solutions that automate the diagnosis and treatment of common conditions. And he's going to help set the stage here for us tonight by doing his own 5-minute presentation, 20 slides. Each slide advances automatically every 15 seconds. So without further ado, Ray.
So, good evening. And I'd like to welcome all of you guys again to Health Ignite. I'm really glad that all of you guys are here. And as Skip had mentioned, I'm your MC for the evening. Now, as your MC, my job is actually fairly easy. I get to give you an overview of Ignite. And then I get to get you all excited about an awesome night of talks. And the good news is that Ignites are actually a lot of fun. So I think we may be frozen up on the slides now, though. Technology, what are you going to do, right? And we're a group of technologists. So anyways, Ignites are fun. And so I'm really excited that you guys are here, and I'm hoping that you are all excited and engaged. And hopefully even a little bit rowdy. That's what Ignites are about, in fact. So are you guys excited and ready to get rowdy? Yeah, that's fantastic. Now, speaking of being rowdy, I wanted to mention the bar. So we up here on stage are depending on all of you guys out there in the audience being relaxed and being receptive, and if it helps, go get a couple of drinks. It looks like you'll be in good company. Now, as Skip had mentioned, these presentations are a pretty unique and challenging format. Every speaker has 5 minutes to present 20 slides, and they automatically advance every 15 minutes, or 15 seconds. So that's enough to be able to make pretty much any public speaker run and hide. But we have got 17 brave presenters who are going to be up here tonight that are going to inspire and entertain you. So let's give them a round of applause. Now, I also wanted to talk really quickly about what motivates us all to be here. This is IgniteHealth, and everybody here up on stage and in the audience is passionate about making healthcare better. And it is a very exciting time to be making healthcare better. Now, to get everybody ready, I want to take just a minute to talk about where healthcare is at and where it's going to. So first, let's start with something simple, the definition of value, which is a ratio of quality to cost. Now, for healthcare in particular, quality ends up breaking down into outcomes and experience, and that gives us the IHI triple aim, which a couple of you folks may have heard about. So how is the US healthcare system doing delivering on that ratio? Unfortunately, not very well. Now, we spend almost 20% of our GDP on healthcare. Now, that's a crazy number, given the fact that we spend 50% more than any other country in the world, and twice as much as the average developed country. And in terms of quality, we may be number one in cost, but in terms of quality, the WHO actually ranked us 38th in the world. That's below Dominica, who incidentally spends 7% of what we do on healthcare. And we are consistently ranked last in terms of developed countries. And unless you want an earful, don't get people talking about their experience as a patient. We're talking about frustrating scheduling, long waits, rushed providers, confusing information, and a great big surprise bill at the end. And for providers, the experience isn't much better. They have declining reimbursements. They have changing business models. They've got difficult scheduling. They've got lots of paperwork. And it's just challenging for them. That's the facts of it. Our healthcare system is broken. And a quick explanation of some economic principles can help understand why. Any economic system that's efficient has three things. They've got a large number of competing suppliers that are competing around value. You've got customers who want value, and you get a system that provides it. And the US healthcare system has none of those. So we are remarkably inefficient. We've got fee-for-service, which actually disincents for value. We've got huge barriers to entry that keep efficient systems out. And the payer system insulates patients from the cost of care, so they don't have a reason to go look for lower cost, higher value care. And even if they were interested, there's not a system that provides cost and quality information. Now, the good news is that things are changing, and we're moving to risk-based models like ACOs, where providers actually get paid based on the value that they create. And we're moving to high deductible and CDHP plans that motivate patients to to look for higher value care. We're implementing EMR systems that make quality data easier to track. And we've got innovative startups like Castlight and HealthSpark that are providing better access to quality and cost data. So we're engaging and empowering patients and providers, and that means that there's more space for innovative new healthcare delivery systems to help healthcare leap forward. So for the rest of the evening, you get to hear some really exciting talks about how healthcare is improving and how we can make it better. So from understanding the Affordable Care Act to ideas on crowdsourcing research, from conscious breathing techniques to psychedelic-assisted chemotherapy, it is an awesome night of talk.